Ready? Ready. Okay, good morning, everyone. We are here to open the OASPA conference. Welcome to Lisbon, my absolute favorite, probably city in the world, actually. My name is Agata Morka. I am Regional Director for Publishing Development at PLOS for Europe. So Europe is my playground. And it is my great pleasure and great honor to moderate this panel here for you today. So we will see who cares about equity and how this concept morphs when it's seen through different lenses, different stakeholders, placed in different contexts. So equity seems to be the buzzword of the hour, and not only in scholarly publishing, but since we are here today to talk about scholarly publishing, let's look into that. So it's the topic that definitely fuels industry conferences like this one, for example, fills the pages of reports and fuels targeted events. So we all talk about it, but what do we really mean? Can we actually grasp the essence of equity among all this chatter? And I can tell you that while we were preparing for this panel, I think that it was the very first experience in seeing that equity, when you want to act in an equitable way, it can get tricky. You can see that one of our speakers will be joining us remotely, despite our best efforts to bring her here. You can also see that we only have women on the panel, which, not that I am very sad about this, because I love to have strong women's opinions here, but something to keep in mind as we embark on this discussion. So we will look at how different stakeholders of the scholarly publishing landscape approach the equity, define it, and how they act on it in their everyday experiences. And we will do so with our four stellar speakers here. So I will start on my right, Silke Davison, who is Community Manager for OAPEN Foundation and Directory of Open Access Books. She manages the relationships with library supporters and leads the marketing and communication activities for both organizations. She is also one of the three coordinators of the Open Access Books Network, and we will talk about this a little bit more. Silke has a background in publishing. She previously worked for Frontiers, Springer Nature, and she holds an MA in publishing. Welcome, Silke.
Thank you.
And next, we have Vanessa Proudman, also on my right, Director SPARC Europe. Vanessa, as she likes to say, is working to make open the default in Europe. Vanessa has over 20 years of experience working with policymakers, with advocacy organizations pushing for open science, for open education, open culture in general. And prior to SPARC Europe, she worked at Tilburg University, and also was program manager at Europeana. So welcome, Vanessa. Thank you very much for joining us here. And now on my left is Durhane Wong-Rieger, who is chair of Rare Disease International, board member of Asia Pacific Rare Disease International. She is also member of the editorial board of the Patient-Centered Outcomes Research, member of the Global Commission to End the Diagnosis Odyssey for Rare Diseases. This is among many of her other engagements. In Canada, she is president and CEO of the Canadian Organization for Rare Disorders. Durhane has a PhD in psychology, and for many years she served as professor. And our next speaker hopefully will be joining us remotely. Can we get Joy on the screen? Yes. Hi, Joy.
Hello.
Can you hear us?
Very well.
Good, wonderful. You are here on a very big screen. So here is Joy Owango, who is founding director of the Training Center in Communication, so-called TCC Africa. TCC Africa is a trust registered in Kenya. It was set up in 2006. It's the first African-based training center to teach effective communication skills to scientists. And Joy also sits on the steering committee of the Research Organization Registry at the International Science Council's steering group on the project on the future of scientific publishing. Welcome, Joy. Thank you so very much for joining us here today.
Thank you. Thank you for having me.
Good. So now let us come back to where we are, the city of Lisbon, the magnificent city of Lisbon. So one of the things that Lisbon is known for, apart from bacalhau, of course, and the yellow tram number 28, are the miradouros. And miradouros are these points scattered around the town, usually placed very high, so that you get a magnificent view when you get there. So miradouros are places where you stop for a little bit, where you contemplate a particular viewpoint and you let yourself get immersed in it. So today in this panel, I would like to take you on a journey, and we will visit 3 miradouros. We were granted 75 minutes to tackle the idea of equity. And as you can imagine, this is not a lot of time for such a task. So what we're going to do, we're going to divide it into 3 different miradouros. At first, we will look into the notion of equity itself. What does it mean? What is it actually? Then we move towards looking into different stakeholders, different lenses, different contexts in which we see equity, from which we see equity. And then for the third part, which is probably the one that I'm most excited about, we will look into tangible examples of our speakers acting on making equity the norm in scholarly communications. So before we embark on this journey, I think that we need a solid warm-up, also because miradouros usually are very high. So let's warm up. And here is where I would like to turn to the audience. Just a warning, you will be asked to participate several times during this panel so that you don't fall asleep. So for the first exercise here, I would like to ask you, you will see the Mentimeter appearing on the screen in a second. There you go. And if you scan the QR code, you will see the first question that we put there, which is, which 3 words come to your mind when you think about equity? And hopefully, we'll be able to see the results also on the screen as you enter your responses. So 3 words. For now, we have 0 responses, which is not encouraging. So I would like you to... Yes, of course. Could we go back to the slide with the QR code, please? Yeah. So again, which 3 words come to your mind when you think about equity? Can we go to the next slide, please, with the responses? There you go. Okay, wonderful. Thank you for your participation. Quite interesting. So we see words as fairness. Fairness, I guess, is probably the one that is the most used here. We also have opportunity, interesting. We have access, justice. We have global. I think that it's okay if you stop introducing your responses now, otherwise I think that something bad will happen to our eyes. So, is it just going to keep popping like this? Okay, fine. We can deal with that. We can deal with that. Beautiful. So, look at this word cloud. Again, can we look at it again? Or... Thank you. So fairness at the very center of this exercise. Then justice, equality, access, diversity, inclusion, everyone. That is a nice way of approaching it. There are also other things that are perhaps less expected, like critical. I would very much like to look into that more later. No APCs, wonderful. Quality, advantage, transparent. All of these things in the end came up in one way or another when we were preparing for this panel, when we were thinking about it. And I asked our speakers, I gave them some homework before they came here. So I asked them to each submit one image, one picture that makes them think about equity. They haven't seen each other's images, so it's going to be a surprise to all of us. So I will move on now. If we can go back to my presentation, that would be wonderful. So the first Miraduro, what do we mean by equity? So, Durhane, I will start with your image. So this is the image you submitted. Can you tell us a little bit more why and how does this image speak to the notion of equity?
So thank you. First of all, thank you very much for the opportunity to be here. Thank you very much for the opportunity to be on this panel. Thank you for making this an opening panel. I think as you heard from the introduction that Agata gave, I'm actually previously a professor of about 20 years in psychology, but I also have spent the last 30 plus years maybe as a patient advocate. So I actually, and one of the things I think, as I mentioned before, I was really struck when I left university. All of a sudden I had lost access to most of the articles that I needed. And that was actually, I mean, not 30 some years ago, that was still much more so. I'm also work, I think as you indicated, across the globe. So I work with many communities. I work in Asia Pacific, work a lot in terms of a little bit in Latin America as well. So the challenges I think, that I experienced, certainly as a person who was now detached from sources that would give me access to scientific articles that I needed, are much more, accentuated when you talk about people that live in certainly countries where there is, in fact, very little access to these academic journals. Certainly when you talk about people that are not scholars. I mean, you talk about scholarly access, but for us, we're end users, patients. And I work in the rare diseases space, so you understand what rare disease is that in many cases, these are people, patients and families, parents who are looking for the information themselves because their physicians don't know, their healthcare providers don't know, they themselves don't know. So they're highly dependent on being able to find the information, oftentimes to come in and educate their providers. And when you can't get access to the information, you're in a terribly difficult situation. Many of us also work in patient organizations, and even at the organization level, or all the time I get requests from me, can you get me this, can we find this article? And I think we'll talk a little bit later about why this problem still persists in the way it does, and how I accidentally kind of came into this position to even speak with you, because it's really an accident. We all suffer from it. But it's something that is not our primary job. I mean, you're scholars, you're trying to exchange information. And when I was in university, yes, publishing was kind of the thing you have to do. For us, this is a way in which we get to what we really need to do. So it's something that is important, but it's not our main job. And I think in many cases, we've done workarounds I can borrow from. I sit on advisory committees in which I can, beg from somebody else on the committee to give me the articles that we need. So I'll stop there, but as you can see, this is kind of what, in India and in many other countries, medicines are actually delivered, on bicycles. They're delivered by rickshaws. Information is actually passed, personally. And certainly articles themselves are really, really challenging to get access to. And I think as you also saw in the opening slides, a lot of it has to do with language, not just the English language, but the level of the language. Even if you get the article, if you don't understand it, it's not very helpful. So when we're talking, when you're talking about open access, recognizing we're talking about educational levels, we're talking about geographical levels, we're talking about levels in terms of access from the point of view of who and where do you belong. At the end of the day, it's our belief that, unless you actually can get access to the information, you cannot participate. And I think we've worked hard in the patient community to talk about patients as partners. And the biggest barrier I think we still have in terms of being accepted as partners is having access to the expert information. So, I guess this is why I chose the slide I did. I think this kind of exemplifies kind of how many of us feel sometimes in terms of trying to get access to some of these articles.
Thank you so much, Durhane. Next, Silke, with your image, and I know that your image was actually created using ChatGPT. So tell us a little bit more. Why this particular image? What does it have to do with equity? Is it a clock?
Yes.
Okay.
ChatGPT might not be the most ethical way to create an image, but it's a very quick and easy. I kept coming back to the idea of a mechanism and interconnecting parts, and then I had the idea to use a clock as my image, although you can see it's not a complete clock, and that's on purpose because on the surface, you have something that's quite simple. It tells the time, you know how it works, and it's quite beautiful. You might all be wearing watches, and they're quite beautiful pieces of craftsmanship. But underneath or behind the clock face, it's much more complicated than it appears. There's lots of components and moving parts that require the clock to work, to tell the time. And so I sort of thought that equity is a bit like a clock, because it's something that's beautiful and something that we, would all want to have access to or achieve. And it seems quite a simple thing, because surely everybody should have access and be treated fairly according to their needs. But actually, to make this happen, we all need to work together, everybody in this room as well, and lots of moving parts need to come together so that we can have this equitable scholarly publishing ecosystem. And so that's why I chose this image, or asked GPT to create it for me. And also just a reminder that it's never too late to act on equity if you're not yet practicing incorporating equity into your organization or your work. Then the time is now to act, and I think we'll show some examples on this panel as well of equity in action. So that's my image.
Thank you very much, Silke. And I will move to the next image that came from Joy. So, Joy, if you could speak to this particular image that you chose. Why this one?
First of all, I hope some of you have seen this image before. It's a very common image that represents equality versus equity. For the longest time, we've been talking about equality. We need access to resources. But we failed to consider the justice aspect of it, especially when you're looking at it from a subject-specific level. So I'll give an example in line with what I do. So we set up the center, the Training Center in Communication, to support researchers on how to improve their research output. And it started with something as simple as you need to improve how to write your work. And we realized that amongst the researchers, those who were in the health sciences and in the agricultural sciences had access to resources. Those who were in the social sciences did not have the same level of access to resources. And we're talking about equality. So you're looking at open access solutions. So we have major programs, big programs that you're familiar with, and the bulk of them are focusing on specific research areas, ignoring certain areas. Yet we're in a situation whereby funders are demanding that you need to have a multidisciplinary approach to research, where you need social sciences included in health sciences and agricultural sciences. So how does that help if one part of this community has access to open access resources vis-a-vis the other, or they don't get the same level of support? So when I'm looking at this image, it's about supporting the entire community equitably, regardless of subject matter, regardless of whether you have funding, regardless of region, and also within the same country. Within the country, you'll have universities that have more resources as compared to the others. So it's about putting everything on a leveling plane and being pragmatic on how you can build equity and social justice. And on the left-hand side, you can see how equality works. not everybody is going to get the same support. You will get support, even if you're looking at it from an open access perspective, but not the same support. So that is equality. But when you look at it from an equity perspective, everybody will get the same support and you will have the same, more or less the same kind of results coming out of the support. So in line with what we do, we've been pushing to make sure that the resources that come to Africa, first of all, are representative of the continent, even if it is free. It is open access. Yes, you're building equality, but you're not building equity if the data is not representative of the continent. So we've been actively doing that. That is number one. Number two, we've been actively working with governments to make sure that they adopt open science practices and they can improve their production of their journals, such that they can also improve their journal selection strategy within their respective governments. The most recent one we've done is this morning with the government of Tanzania. That is building equities. You can have as many open access journals so that you can increase the visibility of your output, but also produce better journals. And these are the standard criteria that you need to use in order to compete with those open access journals. That is equity. So equity is about including the community, just not giving us free things, but including us to make sure that whatever you give us is representative. So that is why I chose this image. So as I think some of you have seen it, but this is the context of how I see it.
Thank you so much, Joy. And now moving to Vanessa's image, which is the last one in the batch.
So I can see some surprised faces. You might think, what does that have to do with equity? So this is my vision for equity. These are very strong, durable houses. If we want to have an ecosystem, a scholarly communication system that is healthy in the future, that we are all building right now, equity is really fundamental to our organizations. So each of these buildings are our organizations. By chance here, they're all the same size, but we all know we all have different sized organizations. And just as in some countries right now, we are working to save the environment and to look at double glazing our homes for a better environment. There are solar panels, which you can't see on these houses. To make this a better environment, we really need to all play in, either as organizational leaders or as staff within your organizations, to contribute to more equity for a more healthy system. And I'm going to stop there. Thanks.
Thank you so much, Vanessa. So, from what I gathered here, we have a lot of sort of construction site metaphors happening. We had Joy, who said that it's about building equity, suggesting that we're not yet there, which I think is something that we can look into. We have equity being compared to a structure, a solid structure as a house, but that still needs constant improvement, as in solar panels or double glazing. So with that all in mind, I would like to ask a little bit more. Well, that was already personal, but Vanessa, perhaps I can start with you here. So you mentioned this idea of something stable, equity as being something stable. Could you elaborate on that a little bit more and tell us, what does equity mean to you in your specific work at SPARC Europe?
Okay, so first of all, something personal. I promised that I was going to do a nod to my parents who met in Lisbon. So thank you very much for Lisbon for inviting me. And otherwise, I really would not be here. So first off there, I think equity. So for SPARC Europe, of course, our scope is Europe, right? And so if you look at other regions, they say, oh, you don't really have that many issues. We do. There are the diversity in Europe, and to serve our members well, and to look at how diverse the development of scholarly communication is, it's really important for us to really listen to our different stakeholders, to understand what they need, and also to elevate those who do not speak English. Thank you, Delphine, to talk about the different languages. How do we make them part of the conversation? And I saw opportunity on the word cloud. It's really giving and making opportunities for others from all different regions from Europe to interact with the work that we do by listening, but also getting them part of what we do, and I'll tell you a bit more about what we do later on. And this is really daily work. So you were saying this is kind of a moment that we'll be talking about today, but for me, this is like every day, right? Thinking about this. It's really important for us. So it's really about making those opportunities, and so that different parts of Europe and different stakeholders can influence, can contribute, and really participate in the way that they would wish to. And more concretely, if we look at Joy's picture about who do we elevate or who do we help in particular, we're really looking at how can we help Central and Eastern Europe and Southern Europe to be part of this more level playing field. Everybody's at different stages, come from different contexts. So how can we involve them and engage with them? But it's hard, you know, because we don't have that many members from those countries, because it's a sad fact. They can't afford it. Now, we have a tiered system. We have very low fees for them. But we want to engage with them, and we still do that. You don't have to be a member to be served by us. But, you know, so that's a kind of a challenge for an organization that also depends on membership fees. I think, lastly, gender is also really important, gender balance, and also being respectful of different cultures and involving them. So it may sound a bit abstract, but I will come to the nitty-gritty of how we do that a little bit later. Thanks.
Thank you so much, Vanessa. And Vanessa, you mentioned that this is daily work for you. And from you, Durhane, I heard that this is actually not your main job, right? So can you speak to that dichotomy a little bit here?
Yeah, I mean, I will have to say is that, you know, I kind of wandered into this area by accident. I think as many people do. I think most of our things in life are somewhat by accident. But I think it was really also out of frustration. Because as I said, as you move from the academic world into a world in which you're trying to get access to these materials, but you actually have no entry into them. I mean, I will say is that I think it's amazing to, you know, and when I left university, a lot of people said to me, why would you leave a tenured job to go and become a patient advocate? In fact, I had no job I was going to. I just felt this was something important to do. But I think at the end of the day, right, our work has to actually reach the people in order for it to have an impact. We can talk amongst ourselves forever, and we can continue to, you know, but even as, you know, publishers of fiction, you know, one needs to get to people in order for it to have an impact. So for me, I think that was kind of where I came into this. And I think the challenge in terms of moving them beyond your own community and the people who understand you, whether it's by language or whether it's by knowledge, is to really try to translate that into people who are going to now have to do it. And of course, in the healthcare area, that is certainly essential for us. I mean, but it's for many other areas as well, if you think about it. So I think for me, it's been an important journey to really kind of think about it. But as I said, it's something that is an issue. I mean, during COVID, all of a sudden, one of the things we all discovered is we could get access to all kinds of scientific information. We could get access to clinical trials. We could get access to, you know, works that were in progress. But we couldn't get it for anything else that was important to us. So if, in fact, you can trust this and you feel it's essential for people who are affected to be able to have access to that information for COVID, why not for everything else? So I think that was, for me, one of those turning points that said, yeah, how do we make this so that people who really need this information, going to benefit from this issue, can have access to it? And we heard some of the standard stuff, you know, it's risky for people, it's dangerous for people, it's information that's not kind of ready. I think the other thing I would like to say is that one of the reasons why nobody actually does it, not only do they have other jobs, I mean, whether they are doing it because they're trying to advance their care and it's nobody's first job, is that we've kind of developed workarounds. I didn't realize in the 20-some years that I've left university, 30 years now, that we developed a lot of workarounds. You know, my husband taught for many years afterwards, so I always used his account at the library. Well, that was easy. And then when he retired, then my program manager, her daughter was at university, I'm getting her undergraduate account so I can get access to information. How sad was that, right? You know, I'm faking being an undergraduate so I can get information that I can't get. This is not good. You know, but we all learn to do these workarounds, right? I sit on committees where I'm the only patient member among the others, and I have to go beg other people, can I have access to the articles that we're going to be discussing? I mean, that's not really a good idea. And then as a user, I mean, I'm lucky. I'm sort of in that interface where I can figure it out. Many others are not. And I think a lot of what we do is we try to pass that information on. We try to make it available. We try to summarize it sometimes in language that's going to be more accessible. And that's my other plea. It's not just that you want to have the open access. It's not just that you want to have access to the full range of information, but you also need to have it. When we talk about the plain language summary, right? It's got to be more than just that. I mean, I would urge people as you're writing, think about, you know, who your broader audience might be that could benefit from that so that it is accessible to people, you know, not just in terms of the language. AI can help us with some of that language, but it's not going to help us in the other way. I do not know an AI translator that can take it from a university level to a third grade level, and that's sometimes what you need. So I don't know. I think we've got a long way to go, but I'm really grateful for the opportunity to be here, and I've been thinking since we first kind of encountered a couple of years ago how we can actually bring in more users to actually be a part of this, and I'll talk about it a bit later when we start to talk about some of the things that seem to be working and could work.
Wonderful. Thank you so much. And thank you for sharing your creative workarounds with us. With this in mind, let us move to our second Miraduro. So I will have to go back to my slide presentation now. And this is going to be about different stakeholders and regional lenses. And Vanessa, you already touched upon this a little bit in terms of Europe. So I would like to go deeper into these different contexts. But before we do that, I will let our speakers rest a little bit, and I will turn to the audience. There will be two Mentimeter polls, which if you could get online for me, that would be wonderful. We will talk about different stakeholders, and I would like to get a sense of the room here. So which stakeholders are represented here? There will be two polls. First poll will ask you to which stakeholder group you belong. And then the next one will ask about which region you represent. And let us have maybe a minute for that, so that at one point, those little balls stop moving. Well, we have no policymakers. Yeah, that's interesting. What is the other?
I was just about to say that.
Okay. Wonderful. I think we already see some trends. So first of all, mostly we have publishers, which is not that surprising given the conference that we are at. But I am most intrigued by the other category. So who are you? If someone would like to speak, just feel free to, yes, please.
A supplier.
A supplier, okay. Yes? Okay. Anybody else? Yes. Data repository. Brilliant. Yes, Joe.
Intermediary between libraries and publishers.
Interesting. Okay. Yes, there. Open infrastructure. Okay, there. Open access advocate. That's a great category. I think that we should all put ourselves into this particular one. Okay, we have lots of librarians. What is interesting is that there are no policymakers, which perhaps is something to think about also in terms of equity and bringing this particular stakeholder group into our discussion. Could we move to the next Mentimeter poll, which was about which region do you represent? And we only have two to choose from. Wow.
Not surprising.
I don't think that I need to comment on this one. I think that it speaks for itself. But coming back to the slide and the question and the issue that we only had 2 regions to choose from. I think that as we were preparing for this panel, Vanessa, actually you pointed out, well, there are only 2 regions, but there is so much diversity within these regions, right? And you started talking about it. And Silke, I wanted to bring this question to you because you represent a very one of the organizations that you are representing here is the Open Access Books Network. And I know that it's a grassroots organization that has an ambition of being global, and yet, at least at the beginning of its existence, it was very much focused on global north. Could you speak to that a little bit more?
Sure. So the OABN, the Open Access Books Network, is co-organized by 3 infrastructures: SPARC Europe, Open Book Publishers, and OAPEN DOAB. And we are all by default based in the global north, in Europe. And so as a result, that just means, and as it happens, we all speak English as our first language, and that's our sort of frame of reference and our experience in this part. And we can't do it all on our own. It's a voluntary. We all volunteer our time. Our organizations allow us to put some time into coordinating the network. But we also rely on volunteers from other organizations to support us. And it's nice because we've seen people from different places also get involved, but still quite limited to organizations that require that have the time, the resources, the people to be able to put into working with us on a blog series or a webinar series, for example. And last year we conducted a survey just to find out more about our demographics. So not just where people are located, but what type of stakeholder everybody is. It was somewhat similar to what's in this room, actually. And that survey made us realize how even more obvious that we were very sort of Eurocentric, North American, Anglo-centric. So I can speak a bit later in the next Moderator about some of the things we've done to combat that. But it's a bit of a challenge, and but there's some small things that you can do to try and to develop it out a little bit.
Thank you so much. And obviously, it is hard work, as I think this slide speaks to in quite, shockingly accurate way. Joy, I would like to bring this question back to you because probably you are best placed of all of us here to talk about this, this division between the global north and global south. So yes, tell us how it looks like from your perspective.
There are 2 ways to look at it. There is the obvious geographical divide. We can't deny that. There is the geopolitical bit of it, actually 3 ways. Geopolitical bit, aspect of it, and then there's the socioeconomic aspect of it. But unfortunately, we tend to see all that being mashed up into 2 regions, global north and global south, conveniently forgetting even within the global south, there are such diversities as our colleague was talking about Europe as an example. She works for SPARC Europe, but even within Europe, there are such disparities within the continent, and that's how it is within the global south. Even if you break it down to a geographical perspective, like Africa, I love using Africa as an example. There are 54 countries in this continent, but it will be represented by 1 country, South Africa. It's not representative of the entire continent. Or some will go a few steps forward and name the 4 commercial capitals, Nigeria, Nairobi, Cairo, and Johannesburg, still not representative of the continent. Because even within those respective countries, there's such disparities. So even when you're looking at, now connecting it to equity, when you're looking at conversations on equity, we end up finding that conversations tend to lie towards equality when they come to Africa, because you'll be quick to support South Africa, conveniently forgetting the rest of the continent. And the kind of programs that you would provide to support the rest of the continent, you'll forget that there are language barriers, there are technological barriers, lack of inclusion in terms of data. So we're just giving you information, but it's not representative of our work. You can't see you see limited data coming out of this side of the world in those databases, and it is because of that we need to really rethink how we approach equity in the context of the global north and the global south. Yes, we can't deny that terminology exists for a reason, but then let's tear it apart when you want to define the regions you want to work with, and also where you're looking at how do you build equity in Africa. You will realize that building equity in Africa, especially, first of all, even when you use South Africa as an example, they've got a history, a stronger history on social justice as compared to Kenya. So their definition of equity is totally different. And the context, even in terms of access to resources, will always have a component of social justice. And this is historical for them. For us, it's just purely lack of access to resources. So we really need to contextualize, and I know the continent is vast, but we really need to contextualize how we make resources equitable in the continent. I like what my colleague was saying from Canada, that how she was setting resources with the workaround. That's how we've been surviving as well in the continent. It doesn't make sense. You're in a huge project, and the only way we can access the project is if our partner, yes, I'll say it, in the global north has access to the resources. You'll give you the link, or you'll give you downloads of the papers. That doesn't make sense. And even in this day and age, when we have open access resources, there's still some that you will still not have access to. So that has to change, and we are seeing a rise in a narrative in the continent on how we need to access our resources, and how, especially if there's collaboration, how that data has to stay on this side of the world, such that you still have access to that data as well as the partner in the global north, such that you don't have to go through the workaround in order to access the resources. I understand there are always financial implications, but we also need to look at the ethical ramifications of it all. If you're talking about equity, we really need to seriously think through the whole ethical aspect of it. Are you doing it because there's a guilt conscious? I come from the Commonwealth, a term which is also being systematically killed by everyone else who is in the Commonwealth, because they don't like the association of colonialism with that term. But if you come, are you giving us resources because we are part of the Commonwealth, so there's a guilt factor to it, or are you giving us resources because there's a global movement on equity? So we really need to have those uncomfortable ethical questions. When you're having conversations on equity, are you including us because we are thumb-tapped? Like, yes, Africa is done. Or are you including us to be part of the conversation such that the outputs that will come out will have contextualized information representative of the continent? We've seen a few unfortunate cases right now in open science, and where we've just been involved without our inclusion. We've been told, oh yes, this is what is happening, but without our actual inclusion. We shouldn't politicize open science and equity, especially when you're looking at marginalized communities. Even within resource-rich countries, it is so easy to play the Messiah complex and then marginalize them systematically. So we need to genuinely include those communities or those regions. And when we have these conversations of equity, it's much more inclusive, it's much more contextualized. Then we wouldn't be having this uncomfortable conversation on global north and global south, because in our minds we are seeing it is inclusive. Yes.
Thank you so much, Joy. Durhane, I will go back to you here because I know that you have this extensive global experience. So could you also tell us a little bit about this divide, global north versus global south, and the Messiah complex that Joy mentioned here?
No, I think Joy hit all the notes 100%. And I think she also said a couple of other things that were truly important, and that is inclusion and diversity. You know, in the patient community, in the health community, right? We can't talk about equity unless we talk about diversity. Is there true diversity reflected in your membership? But not just in your membership, but in the decision making. You know, you don't have any policymakers here because you really haven't been able to penetrate the policymakers. I think inclusion is the other thing. It isn't enough that we are doing for, and this is what the patient said, right? Don't do it for us. Nothing about us without us, right? I mean, it really is important. But I think I would also ask the question, and where we made some big breakthroughs, certainly in the patient community, is what's in it for you? What's in it for you in terms of having a more diverse membership? What's in it for you to be more inclusive, even in your own research world that you're working in, even in the small projects you're doing? How much better would it be? What would be the difference if, in fact, your research team, if your publishing group that you're doing it actually was more diverse or was more inclusive? How would that improve what edge you would have in terms of what you're doing? And also I go back to thinking, it's one thing to say, you know, and I see the words over and over here, scholarly communication, scholarly publications. But at the end of the day, there's a whole world out there that is not scholarly. And that's where the impact really has to happen, right? Because if we're just talking to ourselves, yeah, okay, we can be a really, you know, kind of a nice elite kind of community. But if we're really trying to make an impact, it's like the housing, right? I can build a great house, but if nobody actually gets access to it, and I don't have the input from the people who are using it, I'm never going to actually have a really useful house. So I think it's, as Joy says, we have to think deliberately about inclusion, and not just inclusion to be on the fringes. We have made big breakthroughs in the patient community, and we actually force patients to be member of decision-making bodies, policy-making bodies, in terms of even in the research, right? The research has to be done by coordinating collaboration with those who are actually going to be part of that experience. And I think that actually, it didn't happen, and the world didn't open up to us because we pushed it and we were an advocate for it. It opened up because the people who were doing it realized, oh my gosh, this is actually so much better. Well, I've got products that people actually want to use. I don't make the same mistakes in going down clinical trials in which I can't get participants because I've not founded it on the basis of the people that are involved. So I think it's for, you know, for everybody, it's like, what's in it for me if I were to actually be more open and more diverse and more inclusive? How does that make what I'm doing so much better, so much more applicable, so much more relevant? We cannot design, as you say, you know, housing that's actually going to be, you know, usable for people unless we've included the people. So I think it's really important. How do we break down those silos? How do we make sure? And that's a deliberate act. It isn't something that just happens. It's something that those who are in the positions of being able to make it happen do by opening up the doors and reaching out. The last thing I will say is in the patient community, one of the things we've done, and one of the ways I got into this was actually one of the pharmaceutical companies had a patient advisory group in terms of patient communications and patient authorships. How do we make the people who are using our knowledge part of the actual writing teams, the publishing teams? How do we make them, you know, authors as well? And I think that was actually a huge, huge breakthrough in understanding. And that takes deliberate training, deliberate effort in order to bring people into that circle so that people feel like they're part of and they're participating as part of, not just being, you know, kind of given or subjects to. And it's a struggle. I mean, I know, I spent 20 years in academia, and I was quite happy there, just talking to each other, you know, until we realized, you know what, we weren't making the impact that we could and we needed to. So I think it's, you know, trying to kind of, and I don't have exact parallels, so I'm speaking to you from my understanding of how we make the breakthroughs in terms of patients. So I'm not, you know, giving you any kind of direct kind of I think, insights into it. But I kind of feel like there's some parallels there.
Thank you so much. And I think that this is a great segue to our third Miraduro. So if I could back to my slides now. And the third one will be about tangible examples of things that can actually be done to improve equity, things that worked effectively, that engaged community, but also, Durhane, you said it's a struggle, and it really is. So if you can also speak to challenges that you encountered while you were working on whichever activities that you want to share with us, please let's talk about this as well. And here we do not have any more Mentimeters, do not fear. But however, if you would like to share some of your experiences with us in terms of activities that you have undertaken, please feel free to just raise your hand and participate at any point of us discussing here. Silke, would you like to go first and tell us a little bit about some tangible examples of effective activities that foster greater equity in the scholarly communications landscape?
So I have a couple of examples from the Open Access Books Network and then also from my organizations, OAPEN and DOAB. So I mentioned we did this survey and the feedback we got was that everything was a bit too anglophonic and European. So something that we thought was quite like a quick win or something that was fairly easy to do was create a blog series looking at open access books in different countries and allowing the people we asked to write that blog from that country to write it in their native language and then either provide their own English translation or we would use a tool to make an English translation. And so far this year we've published 5 of those blogs and the most recent one just last week was on Zimbabwe. So it was in the Shona language. And then we also had the English version and we have blogs from Switzerland, I'm going to forget them all now, India, also from Italy, and then there's a fifth one I can't quite remember. But if you go on our website, you'll be able to read them all. And then this was one way we could incorporate multilingualism into our practices, into our activities that we do. We're not quite at the stage where we can hold webinars or events in multiple languages. It's a bit more tricky to work out, a bit more complicated. Something that we definitely want to think about. And the Open Access Books Network is an opera special interest group. And because of that, we have access to lots of diverse voices and experiences to help guide us, and we can also work closely with the Multilingualism SIG, which Delphine is also part of, he mentioned. And we held earlier in June, we held a mutual learning exercise, look at exploring multilingualism, which was really interesting and a useful exercise for us. So working more closely with the other opera special interest groups as well is something that's interesting. For OAPEN, we have an increase in the number of books and publishers in OAPEN and DOAB. This is by doing some active outreach in other areas, so to get a more global representation and also represent smaller publishers that are perhaps more on the fringe and don't have the same visibility as larger publishers. And then we enable libraries to use the collection for OAPEN and DOAB in whichever way they find the best, so through a knowledge base or an open API or just by directly downloading our metadata. This is free, and it also means that all publishers have the same exposure and libraries have the same access to all the content, which creates a sense of global equity. We also have the Open Access Books Toolkit, OAPEN OAPEN Open Access Books Toolkit, which is a community-led and diverse resource, and it's also free, and it enables researchers to learn more about open access book publishing and find trusted open access book publishers as well. And then just more simple things like engaging in conferences and webinars globally. Thankfully, technology enables us to do webinars in countries that aren't in our time zone or aren't always easy or affordable to travel to. So this helps. And then collaborating with other organizations and doing some more engagement on projects, specifically around equity. So we are going to participate in the Al Masi project, which is due to start in 2025, and that's looking at, it's a European Commission funded project, and it's looking at the international coordination of diamond open access publishing between Latin America, Europe and Africa. And so DOAB will be promoting open access infrastructures to book publishers in Africa, in the region. So those are just some hopefully concrete examples.
Thank you so much. That brings a little bit of optimism into this discussion, I think. And on that note, I will turn to Joy, because Joy, I know that you have some good examples.
So some of the activities we've been doing through the Training Center in Communication is mostly open science policy advocacy. And some of the success stories is that, as I had said earlier, it's making the community understand how they can build their equity in open access. How can they build equity in open access? And we've been working with governments. The most successful one was today, actually, with the United Republic of Tanzania, where we are going to have we guided them in coming up with a smart journal selection strategy whereby they can not only use open access journals to publishing, but also promote their own journals. Produce and use the criteria that have been set by publishers in producing good quality journals, and that is being ratified as we speak, before close of business Tanzania time, because it was presented to the Minister of Education. But this morning, we were finalizing that. So that is a success story. Why is that successful? Because the only country in Africa that has a journal master list, of which most of you are in, is in South Africa through the Department of Higher Education and Training. Kenya doesn't have it. But this is going to be the second country if this is ratified by the Minister of Education. So this is a success story. And why I'm really excited about this is because from just training researchers on how to have access to resources, we've been working closely with various stakeholders from the global north. As I said, I'm not going to ignore that terminology. It is there to stay for a reason, but let's use it properly. So stakeholders from the global north, in making sure that the resources that they bring to Africa are representative. So some of our major stakeholders and partners have been actively working with governments in making sure that their data is indexed in their databases. So some of our partners like Digital Science through Dimensions have been literally working with, it's such a hand-holding process to make sure, yes, we are giving you free access to free databases, but then give us your data so that we can index it. And it's also through them that, and also through them and our program, our open infrastructure program, the Africa PID Alliance, that we indexed African funders in the database. This is the very first time that you're seeing African government funders indexed. So we are talking about equity. When you talk about funding in Africa, what you see is the funding we receive. Rarely do you see the funding that African governments actually provide and the outputs that come out of it. So this is a first of its kind. So these are some of the most recent successful stories. And of course, the one which is at a policy level, which would really have been relevant for all of you if we had policymakers in this meeting, was that for the first time in Africa, we've had 7 presidents, 7 ministers of education sign off an STI policy, a regional STI policy, which includes open science. So with our partners, PLOS, we were behind that, that is within the partner is the East African Parliament through the East African Science and Technology Commission, whereby we're able to come up with the first STI policy with open science. This is the first of its kind in the entire continent. South Africa has its open science draft is at the ministerial level. It hasn't been signed off, but this has been signed off by 7 ministers of education and 7 presidents. So what we are seeing is the winds of change in the inclusion of equity by making sure we work with the right stakeholders on the ground. So we are seeing a narrative in the change of equality whereby you don't have access to resources, we will give you. 2, we see that there is a deficiency in this aspect when it comes to open science. Let's work with you to make it better. And if there was ever a success story, was bringing 7 presidents together to sign off on that. That has never happened in the entire continent. Okay? And yes, because of that, we're seeing now the respective countries in East Africa. Those 7 presidents are from the East African region. So we're seeing now the respective governments trying to adopt open science in different ways. As I said, with Tanzania, with the publishing, the general selection strategy, which will be the second in Africa, the first being in South Africa. In Kenya, we are creating a national open science policy strategy and including, and this is the best part, folks, Kenya is expanding its investment in research from 1% of the GDP to 2%. It's big for us because we were never investing in it. And for that to happen, they have created a National Research and Development Committee, steering committee. And as of Friday, they have included the national open science stakeholders to be part of that conversation. And they will be responsible to not only helping influencing the government in increasing the investment in research, but also setting up the national open science strategy. This can only work if you work with the community. So if we just came in with our partners to say, okay, you need help, that wouldn't have worked. But it is, how can we work together? So the narrative is changing, and it's something that we're seeing in other parts of the continent, because as much as the continent is big, we are all united in one thing. We want our research accessible. We want and visible. We need access to resources, but we also need representation with that, with the access of the resources. And we are seeing more of our partners being conscious. I must say, yes, we are getting more partners who are more conscious and cognizant on how to work with the continent, because they're seeing how diverse it is. And there's a generation right now that is pushing back on just being helped. They want to work together in unity such that these outputs are seen as a partnership and a collaboration, not a donor or developmental perspective in terms of support. So yes, the success stories is we're seeing policy creation, we're seeing more resources that are coming into the continent, which we've been involved with our partners, being much more conscious in the sense that they have more data on the continent. And we are seeing more African partners working closely with our global North partners, not from a point of what's in it for us, but how can we work together to support the academic community to improve the research output and increase our visibility.
Thank you, Joy.
Thank you, Agata.
Joy, you brought up a very important aspect of equity, which I think is policy. And Vanessa, I will bring it over to you because I think that this is a little bit of SPARC Europe's speciality, also dealing with different open science policies, first of all. So would you like to speak to that and other activities that SPARC Europe
So I'm just going to run.
has?
I know we haven't got lots of time, but I'm
We
gonna
still
run
have time.
through a few things. So firstly, I think we're singing from the same hymn sheet as Joy. So it's
Thank
just
you,
so
Vanessa.
important as policymakers and as advocates for change that you are inclusive, and diversity, inclusion and equity is really fundamental to make policy really durable and work, right? And also to get our message out to those who need to know. So how do we do that? So first of all, I think as an organization, what's really key is that you look at your governance and that you really look at the stakeholders who you serve, and that they represent the diverse regions of Europe. So that's what we do. And when we lose a board member, we ask for to fill that gap in the location that we're after. So we have quite a diverse board. Then we have equity and diversity as part of our strategy. So we have a number of strategic goals. And it's also part of our mission. So it really is part and parcel of everything that we do, where we're one of the goals being to strive to enable more equity and open access so that those who wish to publish open access are enabled to do that. So how do we do that in practice? So first of all, good governance is important as an organization. Then think about your strategy, build that into your strategy, but they can be empty words if you don't have the activities to support that, right?
True.
So, so what we do is we really choose our projects very carefully. So there have been some movements we haven't been part of because it didn't really meet the equity goals that we felt should be moved forward. So we have been focusing very much on rights retention and open licensing, with Knowledge Rights 21, for example. The Diamas project and also the previous Diamond project is really close to our hearts, and we're very active there. Perhaps maybe a bit too active, my husband says. SCOS, you also know, that supports open infrastructures globally. We are seeing that many of those infrastructures are sadly built in the US. I say sadly, we're very grateful, obviously, that they're there. But in the US and Europe, we're still looking out to support others in the global regions and ask for applications. But the SCOS board is also made up from all regions of the world, except for Asia. And we always have it on the agenda to try to get that Asian governance member. What we also do is for new projects. So sometimes we are privileged to be invited to the table, and sometimes we're not. And sometimes we're at that table and we think about those who are not at the table yet and who should be. So organizations that represent groups that are important to make progress in this area, we always try to encourage, if we're not leading that project, of course, to include others. So thinking about who benefits from this new project and are they represented in the project partners. So we're not always successful, but we really try. And I know some people in the room will know that we do that. We also facilitate networks, so we help out with the Open Access Books Network, where we share knowledge from all corners, particularly of Europe. We have a European network of open education librarians as well, all at different stages. And we also facilitate a network of national open science policymakers. And I'm quite proud that a couple of years ago, I think it was a group of 4 or 5 Northern and Western European national policymakers, and we now have 25. So we've been working hard to get all corners of Europe represented and to really discuss important issues around open science together in CONOST. So that's, I think, important. And then how we work, co-creation is really important for us also, that you really, when it's hard, you know, particularly if you're part of a project, you have particular results or outputs, What I'm always trying to do is to, when I'm part of a project, and my colleagues also, is can we co-create and collaborate with the communities themselves? Of course, we have the responsibility to deliver, but how do we get there? Yeah, and that we have the voices and that we really understand and that we collaborate with them. So I think that's really important. Have I still got a minute or two?
Yes, yes,
Oh, that's
yes.
great. And then there are other things that we can do for example, I'm privileged. I have English as my mother tongue. I also have German. Many of you don't know. That can come in handy, but not necessarily. What we do try to do is we try to translate some of our material. Now, we're a very small organisation. But for example, for SCOS applications, we've translated that into 3 languages, French, Spanish, and, can't remember the, French, Spanish, Portuguese. So some of the world's languages, so that at least people can apply from globally. But what we also do in the open education work, we developed a toolkit for which describes the open educational benefits for different stakeholders. And that has been translated into more than 15 languages. Now, we haven't done that. The community has. So we said to our community, oh, we really want to have this in different languages. And there were 2 or 3 who then put their hands up. And then others said, we're going to do French, we're going to do Danish, and it's amazing. So we are encouraging that we are also creating template outputs so that they can be localized in different languages. So I think that's really important. And so you don't have to do it all yourself, right? But how can you mobilize others to help you bring this closer to those who need it? And then I think, two other small things. Really, really proud working with the Finnish Learned Society Association of Learned Societies. Last week, we brought lots of learned societies together for the first time to talk about diamond publishing. 170 people registered. Now, they were from all over the place, yeah? So we're often talking about, oh yeah, we need to help learned societies, as you do too, right? But it's been quite hard to get learned societies together in an online webinar. They don't talk together. They don't have a community as such. But we're trying to do more with the Finns and as part of Diamas to see how we can support them with Diamond going forward. And last but not least, there's something which is a bit more fun, which is a fireside chat. So some of you in the room are part of this fireside chat. So there are 3 EC projects, and I'm happy to be part of 2 of them. And I host a fireside chat. It's a 1-hour session. All members of the projects can attend, and we pick a topic which is of interest. And last week, we talked about collaboration. What does it mean to collaborate, the challenges and the difficulties? But I set that up because I was a bit tired of hearing the same voices in the projects and the leaders who have lots of things to say, yeah? Much as I love you, and of course I include myself in that sometimes too. But I wanted to hear more from the other project partners and that they had space and that they also, first of all, that they hear what the others are saying, which we often discuss behind closed doors, but also that they hear what they're saying and often there are some colleagues and they say, oh, I haven't got anything to really add to this conversation, and my goodness, they have. So there's plenty of fantastic things that you can do, right? So there's a real variety there. Now, when you say what doesn't work so well, though, this takes time, right? It really does. So you could go quicker, and it maybe costs your organization money to liaise with your stakeholders more, but I really think it's important. And so I sometimes try to bring this home to some of my project partners, and we've succeeded amazingly in Diamas. We've actually, through our engagement plan, which we've been managing, but all the partners doing the work, we brought 3,000 people together right? Developing things for Diamas. I mean, I was shocked when Andrea told me the number this morning, 3,000 people, right? So that's I think, really, really important that we do those kind of things. So I think I've just lost my train of thought, but I think it's time for me to be quiet. So anyway, there's plenty of things that we can do, and thank you very much for the opportunity to share.
Thank you so much, Vanessa. I will bring it for the last sort of word to Durhane, because Durhane, you and Vanessa spoke to this notion of community that is very, very important. We all spoke to that. That is very, very important when practicing equity. Could you tell us a little bit more about activities in your area of expertise? You mentioned this patient advisory group, for example, as one of the activities. Are there more? Could you tell us a little bit more about that, please?
Well, actually, what Vanessa said kind of blew me away in terms of the variety of things you're doing. But I think one of the things that Joy also mentioned is that in order to bring in others, that patient, from the patient community, it means deliberate training. It means deliberate mentoring. It means absolutely bringing people, as you say, into all the way up to the governance level. So what we try to do is actually there's formal training so that one can actually have formal skills in communications and doing advocacy, but also expert training. What is the knowledge that you need in order to be a participant? Sometimes we bring people to the table and they feel totally out of it because they don't actually have the knowledge. The other thing is mentoring. We rarely bring in a patient into an advisory committee on their own. We usually look for two, because there needs to be that kind of support. There needs to be the mutual learning. And there's also then the necessity to open the door for others to come in. So from our point of view, again, it's not an exact parallel to what you're saying, but I love what you're talking about, because everything you're talking about really reflects what we have been trying to do, and that is deliberately identify, deliberately engage, deliberately train, but also then create the opportunities for people to participate. One of the things that was really exciting for me in terms of how I came into this accidentally was one of the pharma companies actually had a patient advisory group in terms of patient engagement, in terms of writing, and in terms of being an author. And what it took in order to bring in people that were really not scholars at all, but actually had great lived experience to become an author. And to actually be a part of that, I think made a huge difference, and also opening up then the scope of what we mean by being an author. I think that's real. It may open up the scope of what you mean to be a scholar. It may mean opening up the scope of what you mean to actually have a published article that actually includes then much more diverse voices in that authorship. So I would really say look for people who would benefit, but also are not your usual suspects. If you don't have at least one or two people that are not your usual suspect, you're probably not doing a good enough job. So really appreciate learning from what you're talking about as well.
Thank you so much, Durhane. That brings me back to my presentation. So if I could get my slides on. Durhane, you said that it's not about the usual suspects, and today here we haven't heard from publishers, and that was a deliberate strategy. First of all, because especially at publishers' conferences, we tend to talk to each other, and I would like us to talk to other stakeholders of this community. But I, of course, also encourage you to talk about examples of actions that publishers are taking, because there are more and more of them in terms of acting on fostering equity. So today we talked about different meanings of equity, how it can be about, well, let's say diverse governance structure. It can be about multilingual resources. It can also be about something fun, as a fireside chat. We saw that it morphs in different contexts and when seen through different lenses of different stakeholders. But perhaps more importantly, we saw tangible examples of things that can be done to foster equity, and not only in scholarly communications, but also in a bigger sense of, as you, Durhane, said, there is the whole world out there. So this brings me to the final point. Ponto Final. We started with images, and I wanted to leave you with one. It's a magnificent view of Lisbon, yet not from one of the popular miraduros, but from a local restaurant on the other side of the river, of the Tagus River. And seen from here, Lisbon is no longer a bustling cacophony of narrow streets full of herding tourists. From here, it morphs into something different, into something distant and peaceful. And I wish you all a wonderful conference, which will inspire you to look at the notion of equity from many different viewpoints. Explore all the miraduros and enjoy the views. Thank you.
Thank you so much.
Thank you. Thank you.
Well done.
Okay.
That was magnificent.
Thank you so much.